So today I'm going to present on transcranial direct current stimulation, otherwise known as TDCS. So to begin, this is a non-invasive brain stimulation technique that uses low amplitude direct currents to alter cortical excitability. This has led to improvements in language performance and language skills such as increased verbal fluency, picture naming, and proper name retrieval in chronic post-stroke aphasic patients. It has also led to improvements in mathematical ability, attention span, problem-solving memory, and coordination. Before you can use TDCS, you have to make sure you clear some steps even before baselining. So that would include that the patient has a clinician provide medical clearance. The patient cannot have any metal in his or her head, such as an implanted medical device, a skin disease or a sensitive scalp, superficial injury or fracture of the skull in the stimulation area, a previous history of brain surgery, a history of seizures, medications that raise seizure threshold, and or epilepsy. So if your patient has any of these conditions, do not do TDCS. If they are clear, you then want to also make sure that they can endure a 1-minute trial dose of TDCS. So you would give them 1.5 milliamps. If they are not tolerable to that, you could try 1.0 milliamps. However, if they're not tolerable to that, do not continue with this treatment. You then want to do a diagnostic assessment, such as the WAB, which would then give you a detailed diagnostic of aphasia type and severity. And this also helps give you baseline information in regards to their fluency, auditory comprehension, repetition, and naming. Once you've done that, then the electrode placement will need to be determined based on what the patient is working on. So there's TDCS treatment, but you have to pair it with something else. So finding out where you're going to place the electrodes, which stimulate the excitability, is important. So here's an image of all the different places that you could connect the electrodes. So there's obviously a wide variety of places that can be used with this treatment. Placement instructions can be found at totaldcs.com. For my particular patient, though, I'm going to be doing an anomia treatment. So I will be connecting the electrode to the left frontal cortex and another electrode to the contralateral shoulder, which is going to be the right shoulder. And so then the last part of all of these steps is actually doing the baseline task. So because my patient is undergoing anomia treatment, I'm going to be doing a naming task for baseline. So you will have 25 color pictures that depict low, medium, and high frequency nouns. It's important that these nouns are selected by and for the patient in order to make sure that it's relevant and it can be personally applicable. My mock patient really likes to cook, so the nouns that have been chosen detail ingredients or kitchen materials. So in this task, you will hold up the noun, such as this, and ask, what is this? And then you track what they say. You can do it in the moment, transcribing what they say, or you can audio record and transcribe it later, but you would go through all 25 nouns, such as this, what is this, and so on and so forth. And it's important to note that while you are baselining here, you do not want to have them connected to any TDCS treatment, and you don't want to prompt or cue. This is just establishing the baseline and where they are with naming these objects without anything. Then when it comes to the actual TDCS treatment, this is safe and tolerable. However, it has been noted that treatment can span weeks or months, and it also requires frequent trips from your client, so it can be costly in terms of time and travel. However, it does show to have positive effects. With regard to the duration and the intensity of TDCS, there's not evidence of safety beyond 2 milliamps for 20 minutes. For this particular example, I'm doing 1 milliamp for 20 minutes, but if you were going to actually give this to someone, you cannot go above 2 milliamps for 20 minutes. And in fact, I think some of the devices that they sell do not go over 2 milliamps because there's not the evidence of safety for that. So to give you guys a little bit more of a visual regarding what all of this means, the materials you will need for this treatment look like this. For this particular example, I went off of one company's device and device kit. So it's the brain stimulator. There's multiple devices that you can buy from, but this is everything that you're going to need for TDCS. So in this image, you will see that there is the TDCS device, that there is the cable that goes to the electrodes, the actual electrodes themselves, replacement sponges, which are right here, that go with the electrodes, the electrode placement headband, and there's also another headband, a saline solution bottle, and a battery which powers this device. So this is everything that you will need for TDCS. And again, these headbands are electrode positioning headbands. So when we go back to this image, if you're trying to fit a certain electrode at a certain part of the brain, it's important that it's fitting exactly where it needs to in order for it to stimulate the right part of the cortex. So those are all the materials that you're going to need for TDCS. When you're using TDCS, though, you have that and you pair it with something else. So I'm pairing it with an anomia treatment, in which I will use the same cards that I used for baselining for the actual treatment. And again, this patient loves to cook, so the 25 nouns have to do with the kitchen supplies and the ingredients. So I once again have all of these cards, and I'm only going to show 6 for the purpose of time. I then, for the anomia treatment, will want a data tracking sheet that looks like such. I will go over this further. And the green and red buttons for your client to respond. And again, I'll go over that in a bit. For now, I'm going to go over setting up the TDCS device, which again is all of these materials. And to give it some context, it will look like this. So this guy has an electrode here, an electrode here. This is that device box. And there's a computer. You can do some treatments with the computer. For this example, I will be taking the place of the computer. And then here's a woman hooked up to TDCS, so that's kind of what it looks like. So when you're setting up your treatment, you want to make sure that the battery's installed into the main port, into this. And you also want to make sure that this white cable is plugged in on the one end to your actual port box, and the other end is going to go to these 2 electrodes. Now this part is kind of tricky and very important. So there's a red and a black. The red stands for anode, which is a positive stimulation, and the black is a cathode, which is a negative stimulation. And it's important to plug those into the correct box. Otherwise, you could lead to opposite results for your client, which you would not want. So for the purpose of my example, this red anode electrode would go straight to the left frontal cortex, whereas the black cathode, the inhibiting or negative, would go on the contralateral shoulder, which is the right. So in this example, this is the anode on his head, and then this is the cathode on his shoulder or arm. You then want to prepare these sponges, and you want to generously soak these in saline solution. And then these are all the replacements. So you soak those in saline solution. And then on your client, you're going to want, if it's on the forehead, even with a client like me with bangs, it could go through to my skin. So on your client, you're going to want to make sure you clear any dirt, oil, lotion, makeup, anything that's on their skin before putting the electrode on there. And again, making sure the electrodes are soaked in saline solution. And you're going to want to make sure that these electrodes are pressed firmly onto your skin. So like pressed firmly, and the positioning headband can help keep it there securely as well. So that's what that woman has on her head right there's a securing headband. If the electrode sponges aren't thoroughly soaked in saline, it could just cause some discomfort for the client. So you want to make sure that you get those properly soaked. And then to start your session, you would turn on this box by pushing the up button. It turns it on to a 0.5 milliamps. For my example, like I said, it's going to be 1.0. So I would slowly increase to 1.0 milliamps by waiting every 15 to 30 seconds before increasing to the next number. Again, that's for your patient's comfortability. You're going to do the same thing when you're done with your session. You're going to slowly amp down. You don't want to just crank all the way to 1.0 or 2.0. You want to slowly go in intervals. Your patient may experience some slight itching or tingling sensations. That is completely normal, and it should disappear after 15 to 30 seconds. However, if not, you can adjust the electrodes. You can apply more saline solution to the sponges. You could lower the current. So if you were trying to do 2.0, you could lower it to 1.0. And again, I will be uploading all of these directions to our Google Docs for more clarity. And then at any time, if your patient is experiencing discomfort or is just not having a great day and wants to end the session, you can push this off button, which all the currents will stop right then and there. But if you're going to end at the 20 minutes, I would recommend slowly ramping down until you get to 0. So that's all the setup for the TDCS. And now I'm going to move into the actual treatment for anomia. So you're going to want to explain to your client the explicit directions before beginning your treatment. So for this task, the client is going to determine if the displayed picture matches the subsequent spoken word. If it does match, they're going to go ahead and push this green button. If the picture and the subsequent spoken word do not match, they will go ahead and push this red button. So at this time, when you're going into your actual treatment, you want to make sure the TDCS is on and that you're ready to go. Make sure directions are described before turning on the currents, because you really want TDCS paired with the treatment, not wasting time talking about directions while they're getting stimulation. So what you'll do is you will hold up for this treatment. You will hold up this for 2 seconds without saying anything. Put it down and then say the word having the patient look at your mouth. Pot. If they think that this image and this word, pot, match, they're going to push the green button. If they don't think those match, they will push the red button. And so you will go through each of those nouns just like that. So the next one would be like this. Knife, green or red. Lemon, green or red. If at any time the client's not responding, I would then go ahead and prompt them, it's your turn, or I need you to push the button, or I could simply point to one of the 2 buttons. And for the purpose of this treatment, cueing is only going to be 1 repetition of the picture and word. So I could repeat it 1 time. And I would also be giving immediate feedback. So if I held up oven and then said lemon, and they pushed red for it's a non-match, I would give them a thumbs up, a positive feedback of great job, you got the correct answer. If not, I would do like a thumbs down or a frown or bummer, you missed that. And so you would run through all 25 nouns for 20 minutes. So they could get through this 5 times, they could get through this 1 time. No matter where they are with getting through them though, you will power down at 20 minutes because again, that's applying to the safety code with TDCS. So no matter where they are, 20 minutes, shut the device down. And while you are doing this treatment, you will have a data collection sheet to make things easier. This data collection sheet was randomized based off the words shown and the words spoken. And you would want to at least have maybe even 100 or more boxes with randomization as to what gets shown and what gets spoken, in case your clients get through a lot of words. So, for example, I showed pot, I said pot, and then I would track whether they pushed the green button or the red button. And I color coordinated this so that I would know that the right answer is green. But when I got down to oven, I said oven, but I said lemon. So that would be a non-match, and I would mark whatever they push, but that is a non-match. And you go ahead and keep doing this for as many trials as you get through in 20 minutes. And then you continue this treatment for a minimum of 5 sessions. After the 5 sessions are complete, if they got 90% in at least one of them, you would move to the next hierarchical level, which you would add more nouns of probably more complexity. If they don't reach 90%, you would do this 15 sessions. If they still don't get 90% in at least one of the 15, you would just automatically bump them up to the next hierarchical level. And then in order to determine if your patient's ability to name has improved, you would do the naming task that we did at baseline, which is, what is this? What is this? What is this? Without being connected to the currents or to the TDCS treatment. And you would use a data tracking sheet as to if they are naming it correctly. And again, you can transcribe while it's happening, or you can choose to audio record it and transcribe it later, so long as that you're transcribing in the correct order of what word is presented. And you do that type of task at baseline after they've received 90% on at least one of 5 sessions, and 1 week after the final session of treatment in order to determine if maintenance is happening. And if the client is being successful, then you know your treatment's working. If it's not, there are some steps you can do to readjust, such as if your patient is really struggling or has severe aphasia, you might want to include more high-frequency nouns, so nouns that you hear more often. If your client's doing really well, you might want to decrease to some low-frequency nouns. You also want to make sure that semantic content is still really relevant. So if my patient likes to cook, but the 25 words that I'm showing them are words they don't use in the kitchen, we would want to remove those nouns and train nouns that are really relevant and important to them. And then lastly, you can also increase the amount of time you're giving them to respond, or you could increase the amount of prompts, such as, I need you to respond, or it's your turn, or again, just lengthening the time if they're struggling, or shortening the time if they're doing well. And then to determine if they're generalizing, you would use the same 25 words that you have in your treatment, and you would add 50 words untreated, and you would combine to make 75 words and do the same thing. What is this? What is this? And see if they can name that. And again, that's without the TDCS treatment. But because TDCS has shown to lead to such language improvements, you would hope that they could generalize to untrained words. So again, there's the TDCS treatment in it of itself with all of those materials that I showed you, and then you have to pair it with another treatment. So in this case, I did the anomia treatment, and it's all dependent on what the client's goal is. So in the very beginning, when I said it leads to mathematical abilities, if your patient needed some help with math or wanted to improve on that, you could pair that with a math task with the currents. But again, you only have TDCS turn on during the actual treatment in the treatment room, and you do your baselining and your generalization without those currents being on, and you do the actual explicit naming task rather than the green or red button. So I will be uploading all of this information to our Google Docs, and please feel free to reach out to me if you have questions. I would be happy to help, as this is a little bit tricky, but if not, thanks for listening.